This presentation is on Helicobacter pylori-induced peptic ulcer disease by Lindsay Quebodeaux. Clinical presentation. First, we should start by saying that it should be mentioned that most patients do not have symptoms at all of this disease, especially if the gastric lining has not been perforated by the bacteria. Most commonly, symptoms occur once an ulcer has been formed in the gastric lining. Once this ulcer has formed, symptoms can include epigastric discomfort, early satiation, nausea and vomiting, and dark stools. Peptic ulcer disease can cause anemia due to blood loss from acute or chronic GI bleeds as well. This can cause a patient to have the dark stools that we previously mentioned. Symptoms of anemia can present as tiredness and lack of energy. Causes of peptic ulcer disease. Not all peptic ulcer disease is caused by Helicobacter pylori, even though it is the most common. Some other factors that can cause PUD include nonsteroidal anti-inflammatory drugs, such as ibuprofen, coffee, stress, and spicy food. Diagnostics. Most commonly used to diagnose peptic ulcer disease is the urea breath test. Gastric urease, which is the biomarker that is tested to determine the presence of H. pylori, allows the colonization of H. pylori in the acidic environment of the stomach. This test is the most commonly used because it is convenient, precise, and the least invasive method to detect the colonization. Not only can this test make the diagnosis of H. pylori, it is also used to determine the eradication of the bacteria post-treatment, which is very important. An upper endoscopy is routinely used and is also good for patients who would benefit from the biopsy part, as well as determining the presence of bleeding if they have a more severe disease. H. pylori stool antigen assay is also a non-invasive method and can be used to determine the eradication post-treatment. Differential diagnosis. Lots of things can cause dyspepsia, which is the main symptom seen in peptic ulcer disease. Some other causes of dyspepsia that should be ruled out include NSAID use, such as ibuprofen, gastroesophageal reflux disease, and even gastric malignancy. Celiac disease and chronic pancreatitis also share some of the commonly presenting factors as peptic ulcer disease. So you would want to rule out these diseases when you're considering diagnosing a patient with peptic ulcer disease. The location of the ulcers can also be determined when diagnosing peptic ulcer disease because they commonly present differently. For example, whether an ulcer is in the duodenum or in the stomach can occasionally be determined by the clinical presentation. Typically, the duodenal ulcers present with worse pain when the stomach is empty, while the gastric ulcers will present with worse pain when the stomach is full. Treatment. So how do you get rid of this pesky little bacteria? Treatment specifically to H. pylori includes 2 antibiotics plus a proton pump inhibitor, which would be triple therapy. And if you want to add a bismuth, that would be called quadruple therapy. This treatment should be ongoing for 7 to 14 days to ensure the eradication of this pesky little bacteria. A great mnemonic to remember when learning the H. pylori peptic ulcer disease treatment is CAP, just like a ball cap, which is seen pictured. C stands for clarithromycin, A stands for amoxicillin, and P stands for proton pump inhibitor. Metronidazole may be substituted for amoxicillin in patients who are allergic to penicillin, which is commonly seen, but it is important to say that metronidazole is not considered in the FDA-approved regimen that we just spoke about. It is important to ensure eradication by retesting the patient in 4 weeks post-therapy. Why is this? Because the risk of gastric cancer is increased in patients with untreated H. pylori peptic ulcer disease. Thank you very much for your time. I hope you learned a thing or two about Helicobacter-induced peptic ulcer disease.